I agree.
Anyway, let me just tell you about healthcare, because when I spoke to Dr. Ben Carson, he's a neurosurgeon, and I said, "You're a doctor. You're on the ground. You've seen the issues. What are you how are you gonna fix this?" He had a good response about this. Now, here's the issue in America. I think everybody is talking about Obamacare, but what they also don't realize is that we are living longer. The American population are going to their 80s and 90s. Medicare was supposed to be sort of like, it's almost like a casino. You put the money in, and then hopefully you won't live long after 65. So all the money that you put in stays with the government and you survive. Now you're putting in about 25, 30 years, and you're getting another 30 years out of it because they're going to their 80s and 90s. Heart disease is not a problem. That was the number one killer. But the whole obesity, diabetes. So as a country, we're getting sicker. At the same time, our coverage and insurance companies are playing games. When they want to go for procedures, they don't really approve it. You have a lot of third party that are making medical decisions without having credentials to do it. If you become the president of the United States, how would you fix this? How would you fix healthcare, which is a huge debate? And certainly with Obamacare in the picture, are you going to change it back to the way it was? And what is your plan?
Seems to me that where the direction we have to go is to try to utilize the free market system to the best way that we can in order to create an alternative approach. And that means that offering the opportunities for insurance companies to offer better proposals, businesses to offer better benefits. You still have Medicaid and Medicare as safety nets, but the opportunity to really offer alternatives to the free market system. What we see today with Obamacare is a real drag on the growth of the American economy. If I want your listeners to hear any one thing about Jim Gilmore, it is that he's committed to building up the economy and creating new jobs, wages, and opportunities. And second, an expertise in how to deal with the national security issues in order to protect Americans and American interests. That's why I want people to consider my candidacy. But as a part of that, if you build up the economy, you build up opportunity and wages and growth, you create the opportunity for more health care to be offered through benefits through companies so that they keep better workers, offer better wages and better benefits, and you have a freer market in order to be able to choose things. Today, I think there's a discomfort with Obamacare because it nationalizes control not just of medical care, but of people. And I think people are unhappy with that and uncomfortable with it. The mandates for insurance, the penalties, the subsidies, especially the tax penalties that are being imposed are serious drags on the economy and a threat to the liberty of the American people.
And I think they have brought in a lot of people in the system without these people knowing what they're getting themselves into. And you're right, they're being penalized with taxes. The deductibles are very high. There's a sense of confusion among doctors and patients not knowing whether you're covered or not. So there's a major confusion going on with this Obamacare, and I hope you can help it.